The broadcast is live. Fantastic. Now, this is a simple thing to understand. Good evening, Vanakam, Namaste to the whole of India. We are here as a very different program. I think I'll shift to talking in Hindi. Good evening, सभी लोगों को नमस्ते. And हम लोग एक RSSDI social connect initiative कर रहे हैं for a celebration of 50 years of RSSDI चेन्नई से. And I am very very glad and happy to introduce हमारे पास experts है डायबिटीज के फील्ड के. हमारे पास एक्सपर्ट्स है जो आज हमारे पेशेंट और दर्शकगण को समझाना चाहेंगे कि हम डायबिटीज के साथ कैसे अच्छे से जी सकते हैं. इस दौर में नहीं बुलाते, हम ऐसा बोलते हैं कि आप डायबिटीज के साथ जी रहे हैं, अच्छे तरीके से जी रहे हैं, और हम क्वालिटी ऑफ लाइफ पे एम्फेसिस रख रहे हैं. उस दरमियान ऐसे पेशेंट एजुकेशन प्रोग्राम फॉर पीपल विथ डायबिटीज एक अलग प्रकार का पहल हो जाता है, एक अलग प्रकार का प्रोग्राम हो जाता है जो बेनिफिट करे ना सिर्फ उनको जिनको ऑलरेडी डायबिटीज है, पर उनको भी जिनको डायबिटीज का रिस्क फैक्टर है. सो मैं आपको बहुत जल्दी से सारे एक्सपर्ट्स का इंट्रोडक्शन देती हूँ और फिर हम उनको कुछ क्वेश्चंस पूछेंगे जो हमें पहले से कुछ दर्शकों के पास से मिले हुए हैं. हमारे पास सबसे पहले एक्सपर्ट है डॉक्टर प्रशांत अरुण सर. वो है एमवी डायबिटीज के सेंटर से चेन्नई से. एंड हम आपको थोड़ा सा रिक्वेस्ट करेंगे डॉक्टर अरुण सर कि आप मे बी तमिल लैंग्वेज का भी थोड़ा यूज कर सके. तो हमारे पास दूसरे एक्सपर्ट है डॉक्टर कौमुदी जो स्पेशलाइज करते हैं रिवर्सल ऑफ डायबिटीज में, रिवर्सल ऑफ ओबेसिटी में. शी इज अ डायबिटोलॉजिस्ट फ्रॉम अहमदाबाद. तीसरे हमारे आज के एक्सपर्ट है एक बहुत ही यंग डायबिटोलॉजिस्ट फ्रॉम अहमदाबाद अगेन, डॉक्टर तर्जनी व्यास. शी वर्क्स एज अ डायबिटोलॉजिस्ट एट डाया केयर सेंटर. सो विद दैट आई थिंक मैं अपना सबसे पहला क्वेश्चन डॉक्टर अरुण सर से पूछना चाहूंगी कि सर हम जब भी पेशेंट एजुकेशन के बारे में बात करते हैं तो डायबिटीज का पेशेंट एजुकेशन कितना महत्वपूर्ण है इस दौरान जब हमें पता है कि इंडिया डायबिटीज का कैपिटल है और हमारे पास सबसे ज्यादा प्रेवलेंस डायबिटीज टाइप 2 डायबिटीज का है. तो सर आप हमें थोड़ा कुछ बता पाएंगे कि हमें क्या क्या पता होना चाहिए जब हमें डायबिटीज है.
So maybe what I understood is, how do we know that we have diabetes? Is that the question?
All right. So, Dr. Arun, at this time and era where we know that India is a leading country with prevalence of type 2 diabetes, what do you think the basic concept is? What should the people living with diabetes know of? As in, what should be their management basics? Unko, what should they have a knowledge about in terms of managing themselves with diabetes and living with diabetes?
Yes. So now when we say diabetes itself, basically most of the people, because it's a lifestyle disorder, so most of the people tend to develop diabetes because of their diet and lifestyle changes, because most of them after this post-COVID era are not on a diet and they eat what they want and they don't work out. So if people could actually work out, stay fit and healthy, know what they are eating, that is, if they, nobody says do not eat rice and completely restrict carbohydrate. You can eat rice if you have diabetes. It's just that portion control. So know what you eat, control what you eat, work out every day, stay healthy. In this way, you can just simply prevent diabetes first.
फैंटास्टिक. सो हम आज ये बताना चाहते हैं, डॉक्टर अरुण सर ने ये बहुत अच्छे से बोला, आप सब कुछ करो, आप सब कुछ खाओ, पर जो भी खा रहे हो उसका पोर्शन कंट्रोल होना चाहिए. हम सब कुछ एक लिमिटेड क्वांटिटी में खा सकते हैं. एक्सरसाइज अपने लाइफस्टाइल मॉडिफिकेशन का, हेल्दी डाइट और एक्सरसाइज एक बहुत ही महत्वपूर्ण रोल प्ले करता है जब हम डायबिटीज के साथ जी रहे हैं. सो उसी के साथ ही मेरा दूसरा क्वेश्चन डॉक्टर तर्जनी मैम के लिए है कि डॉक्टर तर्जनी, कैन यू टेल अस कि भाई मुझे क्या पता होना चाहिए या अपने ऑडियंस को क्या पता होना चाहिए कि कौन से टाइप्स के डायबिटीज होते हैं क्या?
डायबिटीज मूल 2 प्रकार का होता है, एक टाइप 1 और एक टाइप 2. जिसमें इंसुलिन बिल्कुल भी नहीं बन रहा जिसके शरीर में, उसे टाइप 1 बोलते हैं, जो लगभग बच्चों में पता चल जाता है कि इनके शरीर में इंसुलिन नहीं बन रहा। और टाइप 2 जो हमें बड़े में पाया जाता है जनरली, और उसमें भी हम डिफ्रेंशिएट करें और ज़्यादा साइंटिफिकली सोचे, और ऐसे क्लस्टर्स बने हुए हैं कि वो भी 4 अलग प्रकार का होता है। मैं उस पर इलाबरेट करना चाहूँगी कि पहला प्रकार जिसमें इंसुलिन बहुत कम बन रहा है, जिसके शरीर में इंसुलिन बहुत कम बन रहा है, उसे हम बोलते हैं सीवियर इंसुलिन डेफिशिएंट डायबिटीज़। जिसके शरीर में इंसुलिन बन रहा है पर उसके अगेंस्ट रेजिस्टेंस है, शरीर यूज़ नहीं कर पा रहा, उसे बोलते हैं सीवियर इंसुलिन रेजिस्टेंट डायबिटीज़। तीसरा प्रकार होता है जो टाइप 2 में ही आता है, वो बोलते हैं माइल्ड ओबेसिटी रिलेटेड डायबिटीज़, जो बॉडी में इंसुलिन बन भी रहा है, शरीर लगभग यूज़ भी कर रहा है, पर बॉडी की डिमांड बहुत ज़्यादा बढ़ गई, वो होता है माइल्ड ओबेसिटी इंड्यूस्ड डायबिटीज़। और चौथा प्रकार जो माइल्ड एज रिलेटेड डायबिटीज़ होता है, जो उम्र के कारण की वजह से हमें डायबिटीज़ होता है, जो 50s या 60s में होता है, उसे एज रिलेटेड डायबिटीज़ बोलते हैं।
Wow, that is really very nice and elaborative of you. डॉक्टर तर्जनी मैम ने जो बताया वो एक स्वीडिश पेपर के अनुसार हम पुराने टाइम्स में ऐसा समझते थे कि सिर्फ टाइप 1 होता है, सिर्फ टाइप 2 होता है, प्रेगनेंसी में होने वाला डायबिटीज होता है, बहुत सारे अलग अलग स्टेरॉइड की वजह से डायबिटीज आता है, काफी सारे लोग हैं जो पूछते हैं स्ट्रेस की वजह से डायबिटीज आता है, पर मैम ने हमें अच्छे से समझाया कि एक क्लस्टर्स ऑफ डायबिटीज है। आई थिंक डॉक्टर अरुण ऐसी स्टडीज के पार्ट रह चुके हैं जहां पर हम इंडियन पॉपुलेशन को भी अलग अलग क्लस्टर्स में डिवाइड करते हैं, देख करके उनके शरीर में कुदरती इंसुलिन का प्रोडक्शन कितना है। सो उसी से वापस मेरा next question is to Dr. Arun sir. Sir, I come back to my primary thing as to how any type of the diabetes, how do we monitor that? कैसे किसी को पता चलता है कि उसको डायबिटीज है, यानी उसका डायग्नोस्टिक क्राइटेरिया क्या क्या है, और अगर पता चल भी जाए तो वो क्या क्या कर सकते हैं ये समझने के लिए that where is my diabetes going? Would monitoring be sufficient, and monitoring of what and how? Dr. Arun, you're mute.
So a person will be dividing this because a person who's coming to find out whether he's got diabetes or not, and if he's not done any other investigation outside, he's just coming to know, and maybe he's, because there are symptoms of, maybe people should be taking into consideration whether he's having frequent tiredness or whether he's having frequent urination and symptoms like that, where they can pick up that they have diabetes. And when they're coming to us, it's always better that the patient does the GTT, the oral glucose tolerance test, because it's always better to do the GTT rather than the HbA1c, because doing the HbA1c fasting postprandial alone can even mislead us. But when we do the GTT and when we see the second hour value, we can even tell the patient whether he is a pre-diabetic or a diabetic. So we'll have to take into family history definitely into consideration, because if both parents of the person has diabetes, then definitely you are at high risk of developing diabetes. So definitely, so early, when you find out early, it is always better because we can preserve the beta cells. So however early we find and we treat the diabetes, we preserve the beta cell. And maybe when you're coming itself and we do a GTT and we sign to have high blood sugars, maybe at the time of arrival itself, if the HbA1c, that is the 3 months average blood sugar, maybe if it's more than 9, 10, we even see people coming to us for the first time with a HbA1c of 14, 15. So they don't even know that they have diabetes. So those kind of people, it is always better we start them on insulin, because it'll at least bring down the glucotoxicity. So when I say glucotoxicity, it's maybe a medical term, but maybe we could say that it's sugar that they have developed all these years, which is untreated. So we have to bring them down from the toxic phase first. Maybe insulin will be better at that phase, and then we switch them over to tablets, which will be working better. So this is about people who are diagnosing. And maybe for people who are already on diabetes, if they want to know how their blood sugar is and when to check their blood sugars, maybe 3 months once they can do their HbA1c to find out if their HbA1c is in target, that is below 7 or 6.5. They can maintain their HbA1c. They can regularly work out. They can be fit. And in case they have any symptoms, then definitely they'll have to go approach their doctor. And mainly maybe weekly once or twice maintaining a self monitoring of blood glucose. They can check their blood sugars, because most of them think that they need to just see fasting postprandial finish. No, because that diabetes is there 24 hours. So you need to check fasting postprandial either before lunch, after lunch, before dinner, after dinner. So you'll have to check all the blood sugars, and if all the blood sugars are normal, only then the average is going to come down. And for people who really have a problem in pricking, then lately we've got the CGMS, that is the continuous glucose monitoring system. It's just a patch and it can be attached. It checks every 15 minutes. So in a day, it checks 96 times. Checks the subcutaneous fluid, it takes the interstitial fluid and checks the blood glucose values, and it will let us know the trend. And in that, we will be able to tell the person where his sugar is going up. It's not in the morning or the afternoon or the night. We'll be able to show the person this particular time your sugar is going up, and we'll be able to give the person a personalized diabetes care.
Fair. Totally agreeable with your point on the use of technology in CGMS. डॉक्टर अरुण सर ने हमें बताया कि मॉनिटरिंग सबसे ज़्यादा इम्पॉर्टेंट है जब हम मैनेजमेंट ऑफ डायबिटीज़ की बात करते हैं तब। और अगर आपको पता नहीं है कि आप डायबिटिक हो या नहीं, तो आपको एक जीटीटी का टेस्ट करवाना चाहिए। जीटीटी का टेस्ट आपको बहुत अच्छे से बता सकता है कि आप प्री डायबिटिक हो या डायबिटिक हो। और एक HbA1c का टेस्ट आता है जो 3 महीने की एवरेज शुगर का टेस्ट है, विच इज द गोल्ड स्टैंडर्ड फॉर डायग्नोसिंग डायबिटीज। उसके बाद सर ने बताया कि एक टेक्नोलॉजिकल यूज मॉनिटरिंग, हम पहले तो सेल्फ मॉनिटरिंग ऑफ ब्लड ग्लूकोज को ज्यादा एम्फसाइज देते हैं कि जो प्रिक करके होता है, ग्लूकोमीटर के यूज के द्वारा होता है। एंड एक कंटिन्यूस ग्लूकोज मॉनिटरिंग सिस्टम भी होता है जिसका एक छोटा सा सेंसर का पैच आता है जो हाथ पे लगा रहता है या आप अपने स्टमक पे भी लगा सकते हो। वो कंटिन्यूसली आपको एक लाइव मैच के जैसा आपको कंटिन्यूस अपना शुगर का रीडिंग्स बताता जाएगा, जिसके यूज के थ्रू आप अपनी दवाइयाँ या इंसुलिन का डोज आपके डॉक्टर के पास से चेंज करवा सकते हो। सो थैंक यू डॉक्टर अरुण सर। आई थिंक आई ट्रांसलेटेड द इंग्लिश क्वाइट close to what you said. Thank you. My next question is to Dr. Kaumudi. डॉक्टर कौमुदी, बहुत सारे लोग आके बात करते हैं इंस्टाग्राम पे, फेसबुक पे, सारे सोशल मीडिया पे कि रिवर्सल ऑफ डायबिटीज। नाउ आप थोड़ा सा हमें डिटेल में क्या बता पाएंगे कि कौन सा वाला डायबिटीज रिवर्सिबल है? डॉक्टर तर्जनी मैम ने तो हमें बताया कि भाई इतने सारे प्रकार के डायबिटीज होते हैं, पर उसमें से कौन सा रिवर्सिबल है, और क्या ये मिथ है क्या या भाई सही में भी हो सकता है?
Yes, so Dr. Dhruvi, like before start talking about reversal, I would like to talk about the statistics, the present statistics. Currently, India में 8 crore diabetics है, and by 2045 we are going to have 14 crore diabetics, and most of these people are going to be the working class people. So we really cannot go in that direction. The country cannot afford to go in that direction. So we are left with just two options: either we prevent or reverse diabetes in as many people as we can. So coming to your question that किस patients में reversal possible है, so जैसे डॉक्टर तर्जनी ने ऑलरेडी डिस्क्राइब किया कि जो टाइप 1 पेशेंट्स होते हैं दे डू नॉट मेक इंसुलिन, सो रिवर्सल इज नॉट पॉसिबल इन दीज पेशेंट्स. बट टाइप 2 डायबिटिक्स, इन मोस्ट ऑफ दीज पेशेंट्स वी कैन डू द रिवर्सल.
लाइक रियली नाइस कि आपने हमें सारे स्टैटिस्टिक्स बताए, और सारे स्टैटिस्टिक्स जानना भी बहुत जरूरी होता है. रिवर्सिबल का मतलब आप हमें समझाएंगे कि रिवर्सिबल यानी क्या? वो जड़ मोड से क्योर हो जाएगा क्या? मेरी दवाइयाँ बंद हो जाएगी या फिर मेरा इंसुलिन बंद हो जाएगा? क्या होगा?
यस, एंड जैसे आपने ये भी पूछा था कि मिथ है कि एक्चुअल में हो सकता है, सो द आंसर टू दिस, ये एक्चुअल में हो सकता है. देयर आर लॉट ऑफ स्टडीज दैट हैव बीन डन इंटरनेशनली एंड नेशनली आल्सो. टुडे वी हैड अ होल symposium dedicated to reversal and remission, and they talked about the VOTA study and many other studies which have shown that actually you can cure diabetes. But like I already mentioned, type 1 में ये possible नहीं है. Type 2 patients, and in those also जिनका ड्यूरेशन कम है या जो यंगर है, द रिजल्ट्स आर मच बेटर. सो ये एक चीज हो गई. बट द थिंग इज, बहुत स्ट्रक्चरली एंड बहुत स्ट्रैटेजिकली यू हैव टू डील विद दिस. यू हैव टू मेक लाइफस्टाइल चेंजेस, राइट फ्रॉम योर डाइट टू एक्सरसाइज. किस टाइप की डाइट करना है, यू हैव टू गो लो ऑन कार्ब्स, हाई इन प्रोटीन्स, हाई इन फाइबर्स. Exercises में भी you have to focus more on strength training. So these kind of things, and all of this needs to be done under the supervision of a doctor, है ना. एंड जो आपने क्वेश्चन पूछा कि एग्जैक्टली रिवर्सल हम कब बोलेंगे. सो व्हेन द पेशेंट्स HbA1c, you are able to maintain the HbA1c less than 6.5 even without medications, you can call it a reversal or remission. Remission is a better term instead of reversal. And उसमें भी duration, अगर more than 1 year patient ये maintain कर देता है, we can call it complete remission. But if it is less than that, we call it partial remission.
Dr. Dhruvi, if I can just pitch in.
Yes, please, sir.
Yes, just to pitch into what Dr. Kamudiri sir is saying. I usually don't tell my patient, even though if I see a patient who has actually reversed diabetes or something, I don't even tell them that, you're reversed diabetes. What I tell them is, okay, your sugar is now under control without tablets. This is what I tell them. Because I tell them, oh, you've reversed diabetes, he'll go straight outside from my room to a biryani shop. And then from there, he'll go to Haagen-Dazs or some ice cream parlor and start having ice cream. The minute he'll go tell around the world saying, I do not have diabetes. And then after 3 months, he comes up with a HbA1c shot up. So I tell him, wow, wonderful. So now we will, without your medicines, your sugar is under control. So I usually use the word that. I don't say reversal at all, because in India, when we're talking about India, we should be very careful about what we say, because when we tell Indians, you can take a little, they'll take too much. When we tell them too much, that's it, we're done. They say, my doctor told me I don't have diabetes. What more do you want?
So, sir,
True.
so sir, when we tell our patients, okay, like if there are patients who are coming specially, say, for reversal, so from day one, we need to train them that way. You can eat this, you cannot eat this. It is the education is a part of the whole reversal
Definitely,
thing.
because yes, because lifestyle and diet after the reversal definitely matters.
Yeah, exactly. And you need to explain to them that commitment is required from their side. It is not that
definitely.
Like
because
what the
patient
example that
education
you
actually,
give.
in a type of reversal, patient education, I think, plays the most important role.
Yeah, exactly.
They
So
should know that they are
लोगों ने
walking on a.
Yes, exactly.
Yeah, please, Dr. Tarjan.
So they should know that they are walking on a thin ice. Anytime they can fit back.
Yes, exactly.
Absolutely. So आप सभी लोगों ने एजुकेशन पे जोर लगाया कि किसी को भी पता होना चाहिए कि भाई उनको किस प्रकार का डायबिटीज है, उनको कैसे मॉनिटर करना है, रिवर्सल पॉसिबल है या नहीं. पर मैं वापस आती हूँ डॉक्टर अरुण सर को पूछने के लिए कि दवाइयों के बारे में व्हाट इज योर ओपिनियन. काफी सारे लोगों के पास बहुत सारे व्हाट्सएप के मैसेजेस आते हैं कि ये दवाई अच्छी नहीं है, वो दवाई अच्छी नहीं है, ये दवाई से आपकी किडनी पर असर होता है. Some medications might have a side effect on your kidneys, and that's the myths and rumors moving around in the fraternity. So can you tell us your opinion on the oral agents that are available for our people with diabetes?
Definitely, because so much of myths are there. This is not good. It happens to your kidney. It happens. All I ask because they tell me when I prescribe any medicine, they're like, sir, does this have side effect? Because somebody told me. I said, whoever told you is a doctor. Have they been qualified? I don't know. I have not read about it. I'll tell them, see, I have not read about it, but have you read? There's one question I ask. But generally, because diabetes, in general, when a patient has diabetes, his expense is more. He needs to check his blood sugar. He needs to buy medicines and everything. And in top of that, you develop complications due to diabetes, or you develop any foot infection, or you develop any kidney disease, then the cost is going to still go up. So it's always better to prevent the complications of diabetes. And to prevent the complications of diabetes, I think OHAs definitely play a vital role. Maybe to start with metformin, it's the cheapest and the first drug of choice that is available. So metformin is the cheapest drug available. It's maybe 1 rupee or something. And definitely in early people with diabetes or young diabetes people who are just recently diagnosed, definitely maybe 500 milligrams of metformin itself will keep them under control. But then generally people will be like, okay, I'm not taking medicines for diabetes. Let me just delay the medicines. Let me try something else. Let me try some other procedures. And most of the patients neglect to take medicines maybe on their earlier stages, but the first 5 years, which is very important, they miss. Then there's no point after that they're trying, because they've already, their blood sugars are going to go up. And maybe in the earlier phases, maybe in the initial phases, they can get controlled with a simple metformin. But when they wait and they delay, then we'll have to go into more and more other medications. But now, as far as diabetes is concerned, we've got the metformin, we've got the DPP4 inhibitors, we've got SGLT2 inhibitors, and different class of medicines. And there are medicines for diabetes itself which can actually protect your heart and kidney. And people with heart problems or heart failure, your anti-diabetic medicines can actually protect your heart. So now there are various medicines that can be used, and definitely all these medicines are trial tested and then only coming to the market. So definitely if people around the patients are going to tell them, they'll have to educate the people around them. I think that's the patient's job, to tell my doctor has finished his MBBS, whatever, and he's sitting over there to teach us all this. If you are a doctor, you talk to me, or else you don't talk to me. They can talk some family things, not medical stuff. It's the patient's work to educate the person who's teaching him.
True, very true. That brings me to the use of insulin, and I think I'll come with a lot of preconceived notions about insulin to you, Dr. Arun. But before that, क्या मैं डॉक्टर तर्जनी से पूछ सकती हूँ कि आप मुझे टाइप 1 के बारे में थोड़ा बता सकते हैं?
Type 1 diabetes is something which your own आपके शरीर के जो सेल्स आपको प्रोटेक्ट करने के लिए बने हैं वो ही आपके पैनक्रियास पे अटैक करते हैं और आपके शरीर में से इंसुलिन बनना बंद हो जाता है. आपको सर्वाइवल के लिए, जीने के लिए बाहर से इंसुलिन लेना ज़रूरी है. दैट इज़ टाइप 1 डायबिटीज़. ये आपको कोई भी एज पे पता चल सकता है. जनरली बच्चों में पता चल ही जाता है इन अ वेरी यंगर एज.
सो हमें ये पता होना चाहिए कि अगर किसी के भी बॉडी में इंसुलिन नहीं प्रोड्यूस हो रहा एट एनी एज, इट कैन बी टाइप 1 डायबिटीज, जिसमें इंसुलिन का प्रोडक्शन अपने बॉडी में 0 हो जाता है. अक्सर ये बच्चों में डायग्नोज होता है 90% ऑफ द टाइम, पर ये किसी बड़े एज के पर्सन में भी हो ही सकता है. काफी सारी बार हम ये देखते हैं कि टाइप 1 डायबिटीज वाले लोग या फिर बच्चे या फिर अडल्ट और यंग अडोलेसेंट्स, वो लोग जाके अल्टरनेट थेरेपी यूज करने की कोशिश करते हैं. इज दैट करेक्ट? डू यू हैव एन ओपिनियन, एनी थ्री ऑफ यू?
I think it is collective opinion of all the diabetologists or actually any allopathic doctors, I can say, कि ऐसा नहीं possible. People should raise up their voice and tell that is not possible. जब टेक्नोलॉजी आएगी तब बताएंगे, बट अभी इस लेवल पे नहीं possible.
So हम लोग मे बी शायद कॉमन प्लेटफॉर्म पे है यहाँ, जहाँ पर वी वांट टू रेज अवेयरनेस कि भाई अगर आपको टाइप 1 डायबिटीज है तो आप प्लीज इंसुलिन कभी भी स्टॉप नहीं कीजिए. अगर आप टाइप 2 डायबिटिक है और अगर आपका डॉक्टर इंसुलिन चालू भी करता है तो विदाउट द ओपिनियन ऑफ योर डॉक्टर डू नॉट स्टॉप इंसुलिन. So that brings me to my very important question to Dr. Arun sir. काफी सारे टाइप 2 डायबिटिक पीपल होते हैं, पीपल विद टाइप 2 डायबिटीज. They feel that once you initiate me on insulin, it will never stop, and they have a kind of an inertia in their mind कि मुझे इंसुलिन तो कभी नहीं लेना है. फिर आप थोड़ा सा हमें elaborate करके बताएंगे प्लीज?
Definitely. So, as I told you earlier also, when we start insulin during the glucotoxic phase, so it's always better we bring down the glucotoxic phase with insulin. So this usually how I explain to my patient, that is glucotoxicity. That glucotoxicity, how I explain to my patient is, in case you are leaving your room closed for 1 year, then definitely one cloth is not enough to clean that room. You will definitely need a vacuum cleaner first. and that vacuum cleaner is insulin. And after you clean it with the vacuum cleaner, then you give a cloth, then you can maintain that room with a cloth if you wipe it daily. And that cloth is going to be your tablet. So this is where you use insulin and this is where you use tablets. So definitely once the vacuum cleaner's work is over, you can keep it aside and take the cloth. Like that, once insulin's work is over and once the sugar has come down, we can actually try and shift the patient back to tablet. But there are few patients where when they come to us itself, that is the beta cells have already been depleted over the years being uncontrolled, or them trying to push, saying, I don't want insulin, I don't want insulin, I don't want insulin. Them trying to push insulin is going to make them take insulin lifelong because the beta cells are going to get depleted. So early insulin initiation is always better so that we can stop the insulin and put them back on the OADs. So definitely people can be stopped from insulin and change to tablets once their sugars are under control, provided they start the insulin early. And definitely insulin has no side effects.
You know, हमारे पास अक्सर ये ऐसे पेशेंट्स आते ही है, जैसे आपने बोला कि वहाँ हमें बहुत ज़्यादा एजुकेशन और काउंसलिंग देना पड़ता है उनको to start them on insulin and give them a better treatment options. And like you said, insulin एक बहुत ही beneficial modality है डायबिटीज के मैनेजमेंट में, और इंसुलिन चालू करने से काफी सारे फिजिशियंस भी घबराते हैं. एंड शायद हम आज ये RSSDI पहल के प्लेटफॉर्म के थ्रू we want to propagate the message that insulinization is one of the better modalities for treatment of diabetes, and whatever myths and facts exist for insulinization, which are keeping the average HbA1c of our people with diabetes at a higher level, can be brought down very well if there is appropriate and judicious use of insulinization in our practices. So with that, I would like to also welcome Dr. T. Pradeep Kumar sir from Bengaluru. He's a leading diabetologist and physician in Bengaluru. Welcome, sir. So, sir, we have been discussing at length about different types of diabetes, use of OHA, monitoring, and reversibility of diabetes. Sir, could you talk to us a little bit? हमारे audience के लिए आप थोड़ा सा pregnancy and diabetes के बारे में कुछ बोलना चाहेंगे?
Thank you so much, Dr. Dhruvi. नमस्कार सब दर्शकों के लिए. ये जो diabetes pregnancy में जो आ जाता है, it is something that is very common that we see in almost 1/3 of the diabetic patients who become pregnant. And these diabetic patients can also have a transient diabetic phase because of the hyperglycemic status that they have during the pregnancy state. Now, what we need to understand is this is only a temporary phenomenon, and this over a period of these 9 months time, it is extremely important that the diabetes status is kept under strict control to prevent any complications related to either the mother or the newborn fetus. If we take care of these diabetic mothers in the most appropriate manner, we would get a healthy child and a healthy mother and a healthy citizen to the country. The outcome of these pregnant mothers who become diabetic, 1/3 of them continue to remain diabetic throughout their lifetime. 1/3 of them completely disappear, and the remaining 1/3 of them tend to have a recurrent diabetes during their future pregnancies. So what we need to understand and tell our patients is that we do not have to worry about this particular state. It is a temporary state of hyperglycemia, and the most appropriate treatment during this time is the natural form of treatment, which is insulin. वो इंसुलिन लेने के लिए घबराने की जरूरत नहीं है. इंसुलिन अगर लगातार लेते रहेंगे और हमारा ब्लड शुगर्स काबू में रखेंगे तो पेशेंट्स को अक्सर हेल्दी आउटकम रहेगी प्रेगनेंसी का और उनको कोई कॉम्प्लिकेशंस नहीं रहेगी. So this is my bit of an advice for all the audience who are watching this particular program, and don't have to worry or get scared about using insulin during diabetes with pregnancy.
Thank you so much, Dr. Pradeep Kumar sir. It was indeed very, very elaborative and very precise as to what should be done in hyperglycemia and pregnancy. I come back to Dr. Kaumudi to ask her, prevention के बारे में आप थोड़ा बता पाएंगे? How to prevent type 2
Yes.
diabetes?
Yeah. Like Dr. Arun already described, healthy lifestyle is the key to prevention. And Indians, we are called thin fat Indians. We already are more susceptible to developing diabetes. And on top of that, our eating habits are also such. A traditional Indian thali देखोगे, so we are mostly carb eaters. So बचपन से ही अगर पेरेंट्स टेक केयर करें कि ओबेसिटी बचपन से ही ना आए, वी टेक केयर ऑफ आवर ईटिंग हैबिट्स, we inculcate physical activity right from childhood and make it a part of your lifestyle. मतलब ये नहीं सोचे कि हम लोग चलो कुछ एक्स्ट्रा कर रहे हैं, यही मान के चलो that this is how an ideal life should be, that you child plays, even if you are a young adult, you exercise, you go to the gym, and make sure that your carb intake is not, it doesn't go beyond 45 to 50% in your diet. These are the simple things that you can do to prevent diabetes. And sedentary lifestyle is one of the main causes, so make sure that you at least walk 4,000 to 5,000 steps. If you're not able to hit the 10,000 mark, at least 4,000 to 5,000 steps is going to be very helpful. Like everybody says, sitting is the new smoking. So this is the basic things that everybody of us can do to prevent diabetes.
Fantastic. Thank you, Dr. Kaumudi. So, exercise और diabetes के बारे में आप थोड़ा मुझे बता पाएंगे, डॉक्टर तर्जनी? एक्सरसाइज कितना इम्पोर्टेंट है किसी के लिए जिनको टाइप 2 डायबिटीज ऑलरेडी है या किसी और प्रकार का डायबिटीज भी है तो, और अगर कोई
Yes, but before that,
बड़ी
can I?
हाँ जी। सॉरी डॉक्टर तर्जनी, आपकी वॉइस ठीक से नहीं आ रही थी. You can add if you want to add something there.
Before that, I would like to add to the prevention part. Just का campaign भी कर रहे हैं, part in developing diabetes or developing the child, developing the life of an adult. So the family and the parents play a very important part in gaining the good health of the child from ages 4 to 12. That is what we are pushing forward, and that is what we are aiming for. Yes, and coming back to your question, am I audible, Dr. Dhruvi?
Yes, you are, dear. Yes, you are.
Exercise, of course, diabetic ho, non-diabetic ho, pre-diabetic ho, healthy life के लिए exercise is definitely important. Not only diabetes, for your cardiovascular health also, for generally your capacity building, your lung capacity, everywhere, exercise is very important. And इतना lifestyle हमारा इतना sedentary और इतना junk food या whatever unhealthy whatever we are eating, हम ऐसा बोले कि ऐसा normal खाना चाहिए, तो by default कोई भी ऐसा ले लेता है कि हम डाइट कर रहे हैं. हम डाइट नहीं सिखा रहे, हम आपको यही सिखा रहे हैं जो आपको हमेशा करना चाहिए. आपको कोई बीमारी है कि नहीं है, that is what is supposed to be done generally. पर हमारा लाइफस्टाइल इतना अनहेल्दी हो गया है कि हम कुछ भी ऐसा बोले कि नहीं ऐसा करना चाहिए, ऐसा एक्सरसाइज इनकलकेट करना चाहिए, कि ऐसा ही डाइट होना चाहिए, तो उसमें ऐसा आ जाता है कि डाइट फॉलो कर रहे हैं या कुछ एक्स्ट्रा कर रहे हैं. आई थिंक दैट माइंडसेट हैज टू get on to the people and it will get.
Thank you, Dr. Tarjini.
Just to add
Yes,
on.
yes, Dr. Arun, please.
Yeah. So when we say prevention, people should just try and understand when the mother and father of a person is a person with diabetes, from young, they should just try and bring in exercise in their daily routine. Like they get up in the morning, they sleep, they brush, they eat. Like that, workout should become a part of their daily life. That should not be done separately, or that should not be like it's a work to do. It should be a part of their life. Like working out should be a part of life, like sleeping, eating, and all that. And by keeping your central obesity, the central obesity definitely plays a vital role. So to make them understand that central obesity should not be there, they should try workout, daily, eat clean eating, all that, then definitely prevention is possible.
So, Dr. Arun, I do agree with your point that prevention is possible, and we always say that prevention is better than cure. And for our patients with type 2 diabetes, can I request Dr. Pradeep Kumar sir to talk a little bit about the Indian diabetes risk score, so that हमारे दर्शक जो सुन रहे हैं शायद वो खुद का एक डायबिटीज रिस्क स्कोर कैलकुलेट कर सके.
So, one of the smallest advices that each one of us can give to all of our patients is to make sure that they start beginning by using a smaller plate when they are consuming their food. That by itself will give them a visual satiety by saying that the small plate can be filled up easily with the kind of a food. The second advice that we can give them is to start by beginning to reduce at least 25% of the contents that they were consuming previously. By reducing the total number of calories by itself, that can be the second advice that we can give our patients. Third thing that we need to advise them is to avoid everything related to fast food. अगर हम सब पेशेंट्स को ये बोले कि हमारा पेशेंट्स को जो हमारा दादा दादी लोग जो खाते थे, अगर वो चीज हम अगर रेगुलर खाएं तो वही चीज सही है हमको खाने के लिए. और अगर हमको जो वेस्टर्नाइज्ड डाइट्स अगर इन्फ्लुएंस हो जाएंगे तो वो सबसे गलत चीज है और सबसे बुरी चीज है हमारा डायबिटीज के लिए. सो द सिंपलेस्ट थिंग दैट वी नीड टू डू इज कुछ ज्यादा कुछ नया चीज करने की जरूरत नहीं है, नया कुछ चीज अडॉप्ट करने की जरूरत नहीं है. जो हमारी लोकेशन में जो है, हमारा जो वातावरण आजू बाजू में जो पैदा होती है, अगर वही चीज अगर हम खाएं वही सही है. एंड इंडिया हैज गॉट अ वाइड वैरायटी ऑफ फूड, मिलेट बेस्ड फूड्स. अगर हर जगह में जाएंगे, अगर साउथ में आएंगे तो फिर आपको रागी मिलेगी, अगर नॉर्थ में जाएंगे तो जोहार मिलेगी, वीट तो हर जगह में मिलेगी. तो हर तरह की मिलेट्स जो है अगर हम वो यूज करें तो हमारा शुगर कंटेंट जो इमीडिएटली जो ज्यादा हो जाता है वो चीज हम कम कर सकते हैं. Make a conscious attempt to completely avoid sugar. And that is the simplest advice that we can give. अगर वो शुगर अवॉइड करें हर एक चीज में जो आप वो लोग खा रहे हैं तो वो अपने आप नंबर ऑफ कैलोरीज को कम कर सकते हैं. तो these are the simple tips that we can give for all our patients to make sure that they eat right and keep diabetes in check and control always.
Thank you, sir. That was really very elaborate and quite specific. हम लोगों को अपने ज्योग्राफी के अनुसार, हमारे वातावरण के अनुसार, मे बी अपनी रेगुलर डे टू डे एक्टिविटी के अनुसार अपना डाइट और अपना एक्सरसाइज मॉडिफाई करना चाहिए और फॉलो करना चाहिए. So, Dr. Arun, I still have my question on Indian diabetes risk score. If you can enlighten our audience as to what is the Indian diabetes risk score, it would really help them calculate it and find out what is their probability of having type 2 diabetes in the near future.
No, generally what I would tell my patients is it's always better that you see your family history of diabetes. So basically your family history of diabetes itself, because not only diabetes, even kidney disease, you can see whether your family, anybody has kidney disease, or in your family, if your father, your grandfather, grandmother, or your mother, everybody is having diabetes, then definitely don't, because we don't need to sit and calculate or anything. We just need to see that you are, maybe if your one parent is at risk of, when you have one parent with diabetes, then you are at 80% risk of developing diabetes. But then you have two parents with diabetes, then definitely you are at risk of developing diabetes. It's just all about prevention.
Awesome, awesome. So आज का हमारा फाइनल कंक्लूजन ये निकलता है कि प्रिवेंशन हमेशा बेटर है. अगर आपके पेरेंट्स में से किसी एक को भी डायबिटीज है तो यू आर एट अ हायर रिस्क ऑफ हैविंग टाइप 2 डायबिटीज. हम क्विकली अपने RSSDI पहल के प्रोग्राम के एंड पे आ रहे हैं और मैं रिक्वेस्ट करूंगी हमारे हर एक एक्सपर्ट को कि एक ब्रीफ स्टेटमेंट में कोई ऐसा इम्पोर्टेंट मैसेज जो अपने पीपल विद डायबिटीज के लिए इम्पोर्टेंट है, उनका डायबिटीज मैनेज करने के लिए, प्रिवेंट करने के लिए, स्क्रीन करने के लिए, और कॉम्प्लिकेशन से दूर रहने के लिए। तो आप थोड़ा सा हमें समरी दीजिए व्हाट यू वांट आवर ऑडियंस टू लर्न फ्रॉम टुडेज टॉक।
Eat
Can I
healthy,
go?
stay healthy.
Yes, we'll start with Dr. Arun, then we'll go to Dr. Pradeep Kumar sir, then we'll have Dr. Kaumudi, and then Dr. Tarjini at the end.
Short and sweet is eat healthy, stay healthy.
Awesome. That's perfect. Eat healthy, stay healthy. All right. So, Dr. Pradeep Kumar sir.
To take off as an extension from what a doctor just mentioned, eat right, sleep right, work out right, ensure that you get your good 8 hours of sleep, stay happy always, and always follow what your grandparents used to tell you on what is right to eat and what is it that we need to do. Keep the sitting position as less as possible. Try to be as active as possible for most hours of a day. And these are simple tips that you could probably use to keep yourself away from diabetes and also keep them under check and control.
Perfect, sir. Dr. Kaumudi.
Yes. So to just add on to what already doctors mentioned, in eating right, please make sure that you add some protein to every meal. That becomes very easy, and your carbs automatically go down. So you don't really have to think too much if you just add a little bit protein in every meal. And secondly, so they've already talked about exercise and everything. But if you are a diabetic, please make sure that you get all your blood tests done at least once a year. Please get your creatinine levels checked. That is your the health of your kidney checked once a year. Please get your eyes checked once a year to look for retinopathy. Sometimes because patients are not symptomatic for these things and there's a delay in diagnosis, and then they come to a stage where nothing can be done. So please make sure that you get your blood workup and your eyes checked once a year.
Tarjini.
And I'll like to sum it up to all of this already said. Develop self awareness. Know yourself better, seek help whenever required, and be aware of what you want, what you can have, and what you need to do. Thank you.
awesome. आज अपने सारे एक्सपर्ट्स ने हमारे ऑडियंस को काफी नॉलेज दिया, काफी अच्छा डायबिटीज के बारे में एजुकेशन दिया. थैंक यू सो मच टू ऑल आवर एक्सपर्ट्स प्रेजेंट हियर, डॉक्टर प्रशांत अरुण सर, डॉक्टर टीजे प्रदीप कुमार सर, डॉक्टर तर्जनी व्यास एंड डॉक्टर कौमुदी चिन्नाम सेट्टी. आई थिंक हमें ये RSSDI की पहल को एक स्टेप और आगे लेके डिफीट डायबिटीज 2.0 का अनाउंसमेंट आज हुआ, टेस्ट ट्रैक और ट्रीट का, आई थिंक उसको आगे लेके जाना चाहिए. Education plays the most important role, and that is what all of us as a part of the RSSDI PAHAL program are trying to do for our people living with type 2 diabetes and all other types of diabetes. So with that, I think I'm going to thank all the organizers of the RSSDI PAHAL program, congratulate on the 50th anniversary of RSSDI. Do our experts want to add on to anything before we close up?
So Dhruvi, I would like